So as Alicia said, we're going to talk about using evidence. So I'm Alison, and Gillian, Alicia and Richard are all going to be helping today as well with the webinar. So this will be all about using evidence, or how to avoid getting stuck in an evidence jungle. So bear with us with the jungle metaphors throughout the presentation. But I think it just sums up, I think, how difficult it can be to use, find and apply evidence. And yeah, so that's part of what we're going to be covering today. So with some introductions, so I'm a managing consultant here at the strategy unit, and my background is in evidence analysis. And Gillian and Richard are both going to be speaking a little bit later, so I think you're going to introduce yourselves as you go along, and Alicia, you've just heard from as well. So just to repeat, just use the chat function. The little logo should be at the bottom, I think, or top of your screens. And perhaps you'd like to just test that out now by just introducing yourself using the chat function and just maybe telling us where you're dialing in from today. And again, just to repeat what Alicia said, do use the chat function to ask any questions or make any comments as we're going through. If you're having any difficulties hearing us or anything like that, do let us know via that. And what we'll do is we'll keep an eye on that as we go through the webinar, and we'll just pick up any questions at regular intervals to just address anything there. But if there's any points of clarification, just do let us know. So hopefully that's all working. And we're going to start with a poll, because we're kind of interested in understanding how confident you feel about finding and using evidence. So I think that there should be a poll coming up on your screens. Now, there we go. I think it's just appeared. So if I give you a few moments to just select where you are there. And I think it's where 1 is not at all confident and 10 is like, I'm a mastermind. So it gives us some kind of sense of where you are at the moment. Okay, and we've got, I think, a few votes coming in. I think we've probably got another 1 or 2 to come in, have we, I think? So we've got a bit of a mix of abilities there, which is interesting. So that's so hopefully we'll help you feel more confident by the end of the webinar today. And we'll be covering some of the issues that you might find and some of the things that might help you to build your confidence in using evidence. So I think, should we close that poll and we'll move on? So let me see if oh, here we go. Right, just making sure the technology is working. So what we're going to be covering today, so we're just going to sort of do a bit of myth busting around how to use evidence, share some of the reasons why you might want to use evidence, share some tips with you about tackling some of the main barriers to using evidence, signpost where you might go, and help you to sort the good from the bad evidence. So hopefully that will help you with using evidence more effectively, and sharing with you a few of the shortcuts as well, so that to make it easier for you. And I think I'm going to hand over there to Gillian. So I'll just move this across here, and we'll just forward that onto the next slide, which isn't moving.
Great, thanks Alison. I'm Gillian Cope. I'm a consultant here at the Strategy Unit. I work with evidence research and with qualitative research. So I'm going to start by looking at why use evidence. And I think there are a wide range of reasons to use evidence. Here on the screen are just some of them, and I'll just let you have a moment to digest them because there are quite a few. So as you can see, evidence, why use evidence can have many reasons, but evidence can inform how best to invest finite resources for better outcomes. And the problems that we face in health and care are often complex and messy, and inevitably they involve trade-offs. But using evidence can help decide which interventions, initiatives, improvements and innovations offer the best value for the investment that you're making. And evidence can also be used to challenge some of the assumptions that are out there and to build consensus. So now that we have an idea about what we mean by evidence, now that we have an idea about why we use evidence, we'll now look at sort of what do you think we mean by evidence? So this is another chat function for you to feed back, and I'd just like for you to share some of your ideas about what evidence means. If you could use the chat function to do that, that would be great. Do we have stuff that's coming in?
I think people might be pondering.
Are they?
We've got one here. So information that helps you to make decisions.
Yeah.
Might have some other ones coming in maybe. So real world concrete information to support decision making. So
yep, that's
similar
good.
lines.
Yep.
And we've got data or information that shows how things are going.
Yeah.
And we've got in the form of journal papers as well.
Yeah,
that someone said.
That's all true. And I think actually one of the points that was made about how it's going touches on a point that I'd like to make about evidence is a process, not just an end point. And I think when we look at evidence, we also need to see not how it's just effective, but also how it's appropriate. So look at what impact it has, the feasibility of doing it with the resources that we have, and also from the recipient's perspective, what would be appropriate. So now that we've had a think about what evidence is, what we mean by evidence, we'll now have a look at putting that evidence into some sort of context. So you can see from this this rather colourful Venn diagram, or maybe it's not a Venn diagram, I don't know. But there are three elements there. Well, there's actually four elements there. But of those three circles, we have evidence from research, which looks at, and we'll be looking later on at ways of searching literature and how that's done. There's expertise and experience. So who has who are the owners of the evidence, and where does this reside? How can we have access to it? And then population's needs, characteristics, and perspectives as well. Those are sort of the context of evidence. And this is set against the wider context of social, political, environmental, economic, technological, legal, and I'd perhaps also add cultural to that as well. So as you can see, evidence comes from different sources and it's influenced by a range of factors. So now I'm going to just hand back to Alison to talk about what some of the challenges are.
Okay, thank you. Excuse us. Right, okay, so we're going to move again into another poll. So we're going to ask you, what is your main challenge in using evidence? And this poll should be coming up on your screens very shortly. So we're asking you, is it a case of not enough time, there's too much evidence, you don't know where to start, or don't know how to tell the good from the bad and the ugly, you can't make sense of it, or not sure why I need to. So yeah, if you'd like to pick, there may be more than one reason, but maybe pick the main challenge you're finding in using evidence. Okay, so we've got a couple of results coming in. Just give it another few moments to allow you time to vote. Okay. Do we think that's all our votes so far?
Couple coming in, mate.
So we've got a couple about not enough time. We've got another one, don't know where to start. And I think that's probably, I think that's all of us, I think, at the moment, is it? Yeah, I don't think we've got any more coming in. So hopefully you'll find the webinar will help you with some of that as we go through this afternoon. Oh gosh, my little arrow button isn't working again. It just seemed to be getting stuck. Just bear with us a second. Oh. Oh, there we go. So one of the points that we make, and I'm not going to go into this in too much detail, but this is kind of just here to really reassure you, because one of the comments that we get from people when we talk to them about helping them with evidence is just that the sheer volume and the fact that you're all very busy people. And so just trying to keep on top of the evidence base is just, it is actually impossible. And so the graph just shows the just huge, massive leap in the amount of evidence that's produced in the last sort of, well, this only goes up to 2010 actually. If it was to go up for the last 10 years, it'd probably be another vertical climb. And the scientific literature, there has been an estimate that it doubles every 9 years. So it's really, I guess, the point of this is just to reassure you that if you're finding it really difficult to keep on top of the evidence base, you're not alone, and actually everybody feels the same. And so there are different tips and tricks that we'll share with you today to help you to just manage that sheer amount of information that you have to keep up with. So we'll cover some of those as we go through. Oh, this slide moving, oh, there we go. But is it all valuable? And that's the other problem. One of the reasons that we take time to look at the evidence base is because we're all, as human beings, prone to what's called cognitive bias, because we are, these sort of biases are inherent in the way that we all think. And we see examples of this in the NHS all the time, where we're probably quite guilty of optimism bias, where we really hope that we're sort of probably leaning towards more positive findings and perhaps ignoring the risk of the negative findings as well. And confirmation bias, we often search for information that's consistent with our worldview. Framing effect is also around different people, different perspectives, looking at different problems, or same problems, differently. And the need for coherence is another example. So having the need for these sort of structures and being able to place evidence into our worldview. And I guess the emperor's new clothes is another example. I won't go into a huge amount of detail about the different types of biases, but we see evidence of this in various different interventions and programs and strategies that come out of the NHS. And it's really just to be aware that we're all prone to these biases, and they're sometimes built into some of the information and knowledge that we share across the health service and social care. And just as an example, there are multiple different programs that haven't done well, and it just really, I think, demonstrates the need for testing and the need for looking at the evidence. So one example here is the Scared Straight program. This comes from the criminal justice sector, and this sounds incredibly logical. So the idea was that children and young people would be introduced to prison life and shown how awful it is, and meet with some of the prisoners, and just to sort of almost like put them off this idea of crime as a young individual. And actually the program had the opposite effect. It actually increased the amount of crime rather than encouraged children and young people to sort of steer away from crime. And so you can almost imagine the sort of logic model for that program. It sounds incredibly logical, and the intentions were very good at the start, but actually through testing that program, it transpired that it not only didn't work, it wasn't effective, but it was actually harmful. And so that's why we really need to explore the evidence, because we are investing finite resources, as Julian said, and it just gives us an idea of testing whether something is effective, whether it will help people or harm them as well, and whether it's a good use of resources. So that's quite a nice little example, and it's quite a famous one, so you may have come across that one before. And then the next poll is really just an example, really, of testing some of that. So it's kind of like, how reliable is our gut instinct? So so I think we'll just launch the next poll here, which is, out of every 100 people aged 20 years or over, how many do you think are either overweight or obese? So pick the one that you think is the right answer. Okay, just wait for a couple more responses. Oh, great. And we've got completely different responses here. And we have actually got one person has answered correctly. So the correct answer is 62. But when people were asked, most people, I think 44 people thought Sorry, no, I'm getting confused. The average people thought was 44. But this is just really to demonstrate that actually our gut instinct doesn't always lead us in the right direction because of that tendency to our own different biases that we're perhaps not aware of. And so that's the sort of need to really look to understand what we currently know about what works or what the information is, and exploring what's available in the literature to us. So I'm going to move us on to the next slide. And again, sorry, just bear with us. Every time we do a poll, it just seems to get slightly reluctant about moving to the next slide. Aha, there we go. I think we're moving ahead. So what we're going to do now is just talk you through a very straightforward process about finding, using and applying evidence. So at this point, it's probably worth me just double checking with Alicia if we've got any questions that have come through on the comments or on the chat function before we get into the process of using evidence.
So we've not had any questions as of yet.
Okay,
No,
hopefully that's because it's all making sense. So what we're going to do is just talk you through this process very quickly. So let's start with getting your question right. And you might have heard the quote, I think it's attributed to Albert Einstein, around if I had to solve a problem, if I had an hour to solve a problem, I'd spend 55 minutes thinking about the problem and 5 minutes thinking about solutions. And it's a similar sort of approach with getting your question right when you're looking for evidence, because the more time you can spend on getting your question right and really understanding what you're looking for, the more time you will save yourself when you're starting to look for information, because there's so much information out there. And the more specific you can be about what it is you're looking for, it'll just help you sort of plan that route into where you're going to look, but it'll also help you to decide what's relevant and what isn't relevant. So before getting started, before sort of launching onto your Google page and starting typing in search terms, it's probably worth spending a little bit of time thinking about what specifically you need to know and what is missing in your understanding. And also how you're planning to use that information, because that sort of determines what you're going to be looking for. So typically with evidence-based practice, we tend to look at 4 different aspects. So it's worthwhile thinking, well, what intervention or innovation are you interested in? And it could be a model of care, it could be a clinical intervention, it might be a service intervention, it might be a kind of an approach to doing things. There may also be particular population groups you're interested in. So it could be a population in a geographic area, it might be people with a particular condition, or it might be people above a certain age, or it might be children, for example, but it might just help to sort of think, actually, am I looking at a particular group here? So I'm only interested in evidence that's particularly relevant to that group of people. And it's also worth considering the types of settings that you're interested in. So it might be in primary care, for example, or it might be in acute care, it might be an outpatient setting. So again, worthwhile really thinking that through, and also if there are particular professions or roles that you're interested in as well. And then lastly, what impacts or outcomes are you interested in? And it's quite useful to think of the quadruple aim in this aspect. So it's people are usually looking for something around system outcomes like savings or cost effectiveness. It might be around health outcomes, so does it improve quality of life, or independence, for example, or survival rates, for example. And then also we look at patient satisfaction or patient experience, and also staff experience as well. Increasingly, the sort of staff experience of delivering different services and different changes. So it's worth taking a little bit of time to maybe use this as a framework to start thinking about what specifically you're looking at. You may need to come back to this when you've looked for some evidence, but it gives you a really good starting point, a really good framework. And I think we've got yes, that's right, a chat function again. Sorry, I thought it was a poll, but we're going to ask you to, we're going to do a couple of these true or false questions, so doing a little bit of myth busting as we go through. So we've got 2 here for you, and what we're going to ask you to do is use the chat function to say whether you think they're true or false. So the first statement, evidence means quantitative scientific evidence. So if you say 1 true or 1 false in the chat box. And the second question, so experts, so for example, consultants, experts and academics know all about the evidence, so you just need to ask them, is that true or false? So I'll give you just a few moments to just pop your answers in the chat box. Oh, we've got some coming in.
Yeah,
Wonderful.
Coming in.
Brilliant. And of course, I forgot, is that enough time? Yep. Perfect. And of course, evidence means quantitative scientific evidence. Obviously, that's false. We know that from what Gillian's just talked to us about, and that we know that there is much more to evidence. It's a much broader and wider definition, particularly in the types of types of questions that we're going to be looking at in terms of population health. It tends to be much broader ranging, and we have to think about multiple different types of evidence.
So someone said, they said true, but not enough on its own. So similar to what you just said. So
fantastic.
It can be passive.
Yes, yes.
Other forms.
Yes, absolutely. Yeah, probably my wording wasn't quite right there. And experts know all about the evidence, so you just need to ask them. And obviously that also false, because we do experts and expertise and experience is part of that Venn diagram, and it fits with our research evidence and practice evidence, but on its own, subject to bias, for example. So we it would be lovely if we could just go to one person and who would know all about the evidence, but it's almost impossible for anybody to keep in track of it all anyway. Okay, so we're going to move on now. So we're moving on to the second step of that cycle of using evidence. And this is really around planning your route. So thinking about what type of evidence is most appropriate for your question. So giving you a little bit of tips about what type of evidence to look for and where. And we've got a slightly complicated slide here. We're not going to go into this in all the detail. This is kind of just here for you as a reference point at some point to come back to. So there are different types of questions. So for example, if you're looking at designing a model of care or an intervention or a service change, you might be asking yourself, for example, what are the needs and priorities? Where are the gaps? Understanding different trends and the economic and social value of change. So we've just included here some of the types of evidence that you might use to help you to sort of inform decisions around design. So, for example, it might be needs assessment. Oh goodness, I've forgotten what JSNA stands for, but Joint Strategic Needs Assessment. Atlas's variation, for example, guidance, modelling, horizon scanning. And there's a few different actual sources there. So, for example, NHS England, Public Health England, NICE, the Royal Colleges, charities, for example. So just to give you a few pointers about where you might go, and I know it can be really tempting to just get onto Google and type searches in there, but sometimes it's worth taking the time to go directly to these sources. You may also be interested in effectiveness. So what is the impact of different interventions or models of care, for example? So does X work better than Y? What are the potential harms or risks for patients? Does X offer better value, for example? And this might be where you're trying to look at different options, understanding the feasibility of any change that you're introducing and assessing some of the implications as well. And this is where you would want some of the more sort of research-derived evidence. So it might be that there are systematic reviews that have synthesized some of that evidence for you. There may be individual research studies that are relevant. Economic evaluations where there's an understanding of the cost implications, and it may be that for newer innovations that case studies may be all that's out there. But we've listed here a few of the sources. So, for example, the Cochrane Library is a great source for reviews. Google Scholar is a great way of accessing academic literature. The National Institute for Health Research has a range of different research programs that may be relevant here, and they produce outputs, so quite big meaty reports, but they also digest those in the form of themed reviews that we've mentioned there. And probably a couple of other things just to explain what they are, because I've realised we've used acronyms. So the CLARCs are the applied research collaborations that are funded by the National Institute for Health Research, and they're set up around the country to really work with the NHS to do some applied research. And there's also academic health sciences networks who are, I guess, really tasked with introducing and spreading innovation across the NHS. And then the DOFA is worth just spelling out for you. That's a database that's particularly relevant to public health and health promotion. So given the emphasis on prevention in a lot of the population health projects, that's worth looking at. So there are some of these smaller databases that are quite often available free of charge, but they're perhaps less well known about. So it's quite useful to just be aware that some of these databases exist. And then lastly, you may be interested in, when it comes to implementation, in understanding what lessons have been learned so far, what reflections have been shared, I guess, around different ways of doing things. So how does intervention or Model X work? What are the enablers, the challenges and the triggers for change? So that might help. We might understand that something is effective or it does seem to work, but understanding what makes it work in practice. So this is really all about learning from experience. And so this is where a lot of the qualitative type research becomes particularly useful. But also lessons learned reports are increasingly common, and some of the evaluations that are being commissioned around the NHS and further afield are quite useful. And increasingly you'll find those are published online. Impact assessments and audit reports, for example. So the HMIC database, which is Health Management Information Consortium, that we'll talk to you a bit more about databases shortly, but that's particularly NHS focused, so that could be a really good source. Arm's length bodies, Health Select Committee occasionally produce meaty reports, so they've done a lot on integrated care, for example. Nesta are very good at doing innovative social change type interventions, and then organisations within the NHS like NHS Horizons and NHS Confederation often share some of this more experiential type of evidence, so very useful for informing implementation. And at this point I'm going to hand over to Richard.
Thank you, Alison. Hi everyone, I'm Richard Ward and I'm a research assistant at the Strategy Unit. I'll be picking up very briefly around what kinds of databases we might search and a convenient way to access evidence for NHS staff. So in terms of accessing evidence, registering for an Open Athens account can be quite useful. So it gives access to a range of databases for free to NHS staff. So you'll see detailed guidance on whether you're eligible to do so and the steps you need to take to create an account presented in the hyperlink below. Just trying to switch the slide.
Oh, I've just got a question here. It says, is Open Athens available for non-NHS staff?
Here at university, I think it is.
Yes, and also Public Health England have access. So maybe if you let us know which organisation, and we could probably advise on that.
So I think Victoria, I've just seen a book. So she's Public Health Analyst at Leicestershire County Council.
Oh, right, yeah. So Public Health England, there are arrangements for Public Health England. So actually, if you want to drop us an email, which I think that our email address is at the end of the slides, drop us an email and I can forward you the details of that, because off the top of my head I can't remember, but I know I've got the link.
Doesn't look like the slides. Thank you. So just to give an overview of the types of databases that are available with an Open Athens account, gives access to peer-reviewed sources of evidence within general medical and kind of biomedical disciplines. So this might include PubMed, Embase, Medline, to more, I suppose, practically focused published literature from nursing, midwifery and allied health professions. As Alison mentioned earlier, it also gives access to HMIC, the Healthcare Management Information Consortium. This can be quite a useful resource for grey literature or non-peer-reviewed literature concerning healthcare management science. I'll just skip to the next slide. And what follows here are a list of potentially useful links for people to follow after the webinar. So it gives detail as to how you might register for access to an Open Athens account, some help in terms of structuring the searches that you might do to search these databases, and having a kind of a critical eye for reviewing the research evidence you might find. Now I'll just hand over back to Alison.
Thank you very much. So we're coming on to step 3 of our 5-step process. And this is just a few tips, I guess, to help you filter out the non-relevant evidence. Because if you're searching on Google, or if you're searching a database, or if you're looking at different websites, you'll probably find that you end up with more information than you can really manage. And I think this is where it really comes back to your questions. If you spent a lot of time thinking about your question, this step of the process becomes so much easier, because you'll have a much better idea of what's in and what's out of scope. So that might be from the types of evidence. So that table that we, sort of table that we shared with you about the sort of types of questions, and then where you might go to look for different evidence. That will help you sort of focus in on the types of evidence that are going to be most useful for your question. The context, it will help you to understand. So, for example, if you're looking at integrated working, it might only be, you might not be interested in things, in evidence that's set in a particular single organisation. You might just be interested in evidence that is from an integrated setting, for example. You might also have had some thinking about, whether you're interested in evidence from an international context, or if you're just interested in evidence within the UK, for example. And then, if you remember back to the New Care Models programme, there was an awful lot of learning from other countries. So, for example, the ESTA system in Sweden, the Alzira system in Spain, and the UCA system in Alaska. So I guess they were seen as innovative, and so offered some learning to the NHS. So depending on what you're looking at, there may be that the NHS is a particular leader in that field, or it may be that there's a model of care that we might be able to learn from elsewhere. And I guess that work on your question also helps you think about the scope. So whether you're looking at neighbourhood level, for example, or a system level of working, and it just helps you sort of, I suppose, narrow in on the evidence that's most likely to be useful, and it just means you can sort of easily discard the stuff that isn't. And again, we talked about outcomes when we looked at the questions, but it might be that you're only interested in cost effectiveness, and actually, that means that you can sort of focus in on evidence that does report some kind of cost information. And other ways of narrowing, if you're looking at database searching, other ways of narrowing your search very quickly are limiting by date and publication type. So you might only be interested in journal papers, for example, or limiting it by date. So we're going to do a couple more true or false statements now, just to sort of test how you've been doing. So the first question is, evidence-based practice means practitioners should use their professional expertise. So again, use the chat function, and 1 true or 1 false. And second question, second statement, evidence can prove things. So 2 true or 2 false. And I'll just give you a moment to just type in your answers. I think we've got some coming through, haven't we?
Right, I think we're just waiting on a few responses. Yes. Yes, you've got one coming through saying that one's false, but the second one is true, but not for every question.
Very interesting.
Good insight. Yeah.
Brilliant. It's interesting because the first statement, so when evidence-based medicine was first sort of introduced, as it were, back in the 1990s, and I can remember this, it's like make me feel slightly old, there was a big resistance from clinicians, because they were saying it was cookbook medicine and didn't take into account professional and clinical expertise and judgment. And actually, so yeah, it actually does require, evidence-based practice does require professional expertise, because it needs that expertise and experience to be able to understand and apply the evidence. And going back to that Venn diagram, actually experiential learning and experiential evidence is quite important. So it's kind of an interesting one, actually. And the second one is another interesting one, because you can get into a whole philosophical debate about this, can't you, in terms of what is truth and things like that. But I think often you know, we're not always looking to prove something. So, for example, qualitative research doesn't really prove things. It just really gives us different perspectives, and I guess an insight into different experiences. So, for example, where we've got qualitative research that's looking at patient perspectives, that can give us a whole new way of looking at a service that we just don't have that same understanding as you know, in our roles and health professionals. And so yeah, they're both kind of, there are sort of right answers, as it were, but they're both the sort of statements that are partly true and partly false, I guess, really. So thank you for participating in that, and we'll move on to the fourth step of this. And this is just a little bit about, just a few tips here about understanding what you can trust and how reliable evidence is, and what you can learn from that, I guess. So if you're familiar with evidence-based practice or evidence-based medicine, you might have had some training, for example, in critical appraisal, but we recognise that, you know, nobody has the time to do this for every single piece of evidence. It just takes far too long. But these are just some questions that just to bear in mind when you're looking at, for example, a research study or a case study or an evaluation report. So are you clear what the question or problem is being addressed? Do you think the methods you used are appropriate for the question? So there are guides, for example, on the internet about different study types for different types of questions, and we can certainly provide some links to some of those. But quite often so for example, a lot of the earlier work on social prescribing was done by the before and after evaluation method. So that it's not necessarily invalid, but it has quite a few limitations, because there is the risk of introducing quite a bit of bias. But that's not to say you can't learn anything from that. So we don't. So in evidence-based medicine, we talk about the hierarchy of evidence, and sort of randomized controlled trials, systematic reviews would be at the top of that. But for the sort of questions that we're looking at in population health, sometimes you can't do a trial. It's not always appropriate. You need to do other types of research. So we tend not to exclude things just on the basis of quality, but I think it's just having that awareness of what the limitations are of the study that you're looking at, or the evaluation. So yeah, not necessarily saying, well, actually it's not a randomized controlled trial, therefore it must be rubbish, because that just, a lot of the interventions just won't lend themselves to that type of research anyway. So understanding some of those limitations, what kind of bias might be built into that study. No study or no evaluation is absolutely perfect. Everything will have some kind of limitation, and usually there is some acknowledgement of that in the evaluation or the research study, but you might need to have a sort of healthy skeptical mind when you're reading some of those things. And I guess the bigger and bolder the claim, the more you probably need to sort of unpick that a little bit. And it helps to understand how those findings fit with other evidence. So is it fairly consistent with other sort of studies or other evaluations, or is it standing out as slightly different, and understanding a little bit about why that might be. And then helping you to understand the relevance to your context, so focusing on key messages like outcomes, challenges, enablers. Increasingly, people are exploring unanticipated consequences, so that's quite interesting to sort of get a sense of what might happen from introducing a new change, for example, that you just hadn't factored in. And understanding if the contextual factors in that evaluation study or that research study, are they similar to the context that you're working in? So for example, a really obvious one is if it's in a very urban setting and you're in a rural setting, then there may be some differences that it doesn't quite transfer, but it will give you a sense of helping you to understand how that transfers into the context that you're working in. And then I've just put in here just a helpful link, because there is this useful website that's the claim. It's called Key Concepts for Thinking Critically About Health Claims, and it just gives you some useful pointers. It's like, this is just a little poster that they produce. So rather than sort of critical appraisal of individual bits of evidence, it's sometimes helpful to just have some of these in mind, and it just gives you a nice little, it's quite a fun sort of short digested way of helping you to look at studies in a more critical way. So for example, if it talks about 100% certainty and the risks of, for example, looking at a single study. So that's quite a nice helpful source that we just flagged up there for you. And then finally, we just talk, I guess, really pulling together and making sense and connecting all these different sources of evidence together. So if you think of it, it's a bit like a jigsaw puzzle, really. So each bit of evidence that you find is like another piece that just helps you build up that picture, and I suppose builds a slightly clearer picture as you go. But you'll always have pieces missing. There's always going to be gaps in your understanding. But I guess it helps you understand where those gaps and uncertainties might be, and how you might address those. So if you're introducing a program of change, it helps to understand, what do we already know from existing practice or from research, and where are those gaps, and then how might we fill some of those gaps? Because do we need to do some evaluation to understand some of those gaps? So it might be, well, we don't really know what the long-term effects are, or we don't know what the long-term cost effectiveness is, so how are we going to measure that, or how are we going to understand the impact on I don't know, for example, patients' travel, for example, or their experience. So it helps to sort of identify some of those and make those more explicit. And I think recently there was a webinar from Abby, our colleague, who talked about qualitative valuation. So if that's something that you're interested in, that's a really helpful introduction to understanding how to I guess to create some of that knowledge and create some evidence yourself as well. And then we thought also, just sort of coming to the end now, and we thought it might be helpful to just going back to the jungle theme, just helping you to sort of stay safe, I suppose, in the jungle. So yeah, this is me pushing the jungle metaphor, probably way too much now. But some of the pitfalls, so it's very easy to get stuck in the undergrowth. So we've talked about the volume of evidence and how it can be just completely overwhelming. But hopefully some of the sort of sources and the way you could identify the most useful sources, that has helped you sort of, I guess, target in and maybe create your own path through that sort of evidence jungle. Yeah, again, I feel like I'm stretching this metaphor way too thinly, but there is a risk of picking the first fruit that you find. So it is very easy to, I do it myself occasionally. I will type something into Google, and that Google is so good at finding something relevant on that first page that sometimes it can feel like, oh, I don't need to go much further than that. But it is worth exploring more, because we all live in a slight bubble. And actually, Google, because of the way it works, it will serve up slightly different results to each of us anyway. So there's always a risk that you might miss something. And it's worth, because of that risk of confirmation bias that we talked about, it's worth explicitly and deliberately going out to find evidence that disproves what you're looking for, I guess, really. To just test that you're not, just sort of finding something and then unconsciously thinking, oh, great, it's my way of thinking. So I guess really that is one potential pitfall. Getting swept away by a mudslide. So it can be very tempting in the NHS to go with, we talked about optimism, confirmation bias, and we hear a lot of people saying, well, I've heard about this in a conference and it seems to work really well. And it can be very tempting to get swept away and sort of follow that trail. But again, it's worth looking for conflicting evidence and sort of testing, because I guess what we're looking for when we're looking at the evidence base is sort of almost like testing whether something works or not through what we currently know. And again, blindly walking into a predator's den. So we don't want to accept evidence at face value. Again, coming back to that sort of healthy skepticism of really unpicking something. So if and particularly if it's making nice bold claims about reducing emergency admissions by 10% or something, just really being able to unpick that and understanding the limitations of that particular source. So some of the sort of accepted shortcuts, it's worth looking for existing reviews. So quite often people might have already done a review of the area or the question that you're looking at, and that could be a helpful helpful shortcut, or if there's an existing summary, for example. We try and share, for example, some of the work that we do where we have permission from clients. So, it's worth checking, and there's other services that do similar sorts of things. If you're really not sure where to start, there are search engines that are specific to the health and social care field that aggregate different sources. So, for example, the NICE evidence. So you can start there because it's only looking at health websites that are relevant. So it means you won't get stuff from outside of health and care. So it's not as big as Google. And they often will present the evidence in a sort of presented back to you, not a hierarchy, but in a categorized way. So it helps you to just focus in on different types of evidence as well. So there are a couple of examples there that can be a good place to start if it's completely new. And also some people do share searches. So for example, the King's Fund Library and the Health Services Management Centre Library, they both do searches and reading lists. So they quite often do topical subjects. So it's worth definitely checking those because somebody's already done some of that work for you. So there's a couple of different shortcuts there that hopefully help you find your way through. And then I think we're going to move on to a last true or false question, I think. So again, if you're happy to use your chat function, and we're just asking you 2 more questions again. So question 1, or statement 1, sorry, collecting valid and relevant evidence gives you the answer in capital letters to the problem, capital letters. So 1 true or 1 false. And statement number 2, if you don't have the evidence, you can't do anything. So 2 true or 2 false. So I'll give you a few moments to just type in your answers there. Have we got any answers coming through?
Oh,
there we go.
Just going through.
Brilliant.
Double false has been said.
Oh, yeah,
suggested.
yeah. Just give a couple more moments.
And then something. So for the first one, it makes it more likely you'll come to a good answer.
Oh, I like that. That's a very good answer. Just give it another minute or 2. Well, another moment.
Can't see any more.
No, can't see any more coming. Yep. So yeah, all of those answers are right, and I do like that. That it makes it more likely that you'll come to a good answer. So,
sorry, for number 2, you'll have no confidence you're doing the right thing.
Ah, interesting. Yeah. So I guess we rarely find the answer when we're looking at evidence, and but it can, as Gillian said at the beginning, it can make you better informed. And I think that's the key. And it can also help you to understand the problem a little bit more as well. And then if you don't have the evidence, you can't do anything. Well, no, that is false, because quite often the evidence is either conflicting or there just isn't enough of it. So sometimes we can't find, if it's particularly new, there may not be research evidence, there may be very small innovation case studies. And other times, I guess, the evidence base is quite conflicting. So, for example, with social prescribing, a lot of the early evidence was very conflicting. So some studies were showing it works, some studies were showing it didn't. And so that makes it really challenging for people, because actually it sort of shines the light on some aspects, but it doesn't really give an answer. It doesn't provide you with a way forward. So evidence is, I guess this point is evidence is, again, going back to that jigsaw metaphor, it gives you some pieces to start building that picture, but it does fit with the population needs information and the expertise and experience information, that Venn diagram that Gillian showed at the start. So that's kind of a run through of the process. I put this quote in because I think it's quite a nice quote, and I think it just reiterates the sense that the bolder the claim, the more skeptical we have to be, really. but it's just practicing, I guess, that sort of critical thinking, and just exploring some of the evidence that's out there, and I guess really getting into that discipline of understanding what we currently know from evidence from research and evidence from practice. So just want to finish with the sort of offer of help, I guess, really. So our approach in strategy is to provide some help and support, and we offer a range of different ways of doing that. So if there is anything we can help with, do get in touch with us. We produce a regular newsletter called Evidence Insights, which is free, and there's no junk mail, so you don't need to worry if you sign up and you won't get an email box full of awful spam. And you can sign up for that on our website. If you scroll to the bottom of the screen. We have just published a special edition on patient-centered intelligence. So I think if you sign up, that, I don't know whether that will come through or not, but if you need us to send you that, then just drop us an email, and our email address is on the next slide, I think. But yeah, I would encourage you to sign up to that. It's really just a very quick digest of interesting new evidence, and so it's designed to be a very short and sharp sort of quick alert to some interesting new studies or interesting new guidance, for example, and so it's designed to help and not hinder. So hopefully it will be a useful sort of update on some of the things that you might have missed, and yeah, it gives you a quick summary as well, so you don't even have to go off and read the full report or the full papers. And again, just if there is anything we can help with, do get in touch with us. We're very happy to help. And I think that's everything. So I don't know if there are any questions or anything we can help with, if you'd like to share anything via the chat page, but just like to say thank you very much for joining us this afternoon. I hope you found it useful. It's always great to hear any comments. So if there's anything we could do better, do let us know. But thank you for joining us, and hope you found that useful. I'll just flag up our web address, email address, sorry. So if there's anything that I mentioned or any of us have mentioned today that you'd like more information on, particularly around that Public Health England Athens access, just drop us an email and we'll get that sorted for you as soon as we can. So thank you very much for your time.